Hello everyone, welcome to my another video. Today we discussed about important MCQ on high-risk pregnancies. This is part 2. For more important MCQ on nursing subjects, make sure you subscribe to this channel. Question number 11. Nurse caring a high-risk pregnant lady with heart diseases must know which one of the following valvular lesions cause death during labor. Option A, aortic stenosis. B, aortic regurgitation. C, mitral stenosis. D, mitral regurgitation. Right answer is option C, mitral stenosis. The typical rise in volume and heart rate in pregnancy is not well tolerated in patients with more than mild mitral stenosis. Hence, mitral stenosis is the valvular lesions cause death during labor. Even a severe aortic mitral valve regurgitation is usually very well tolerated in pregnancy unless there is no left ventricular failure. Patients with aortic stenosis can tolerate pregnancy well with mild or moderate level of obstruction. Next question. A client with abruption placenta is at a risk for developing option A, thalassemia, B, idiopathic thrombocytopenic purpura, C, disseminated intravascular coagulation, D, all of the above. Right answer is option C, disseminated intravascular coagulation. So, a client with abruption placenta is at a risk for developing disseminated intravascular coagulation. Next question. Sodium and water retention occur during pregnancy because of option A, increased ADH, option B, increased aldosterone, C, increased estrogen and progesterone, D, all of the above. Right answer is option D, all of the above. Sodium and water retention occur during pregnancy because of increased ADH, increased aldosterone, and increased estrogen and progesterone. Next question. Which of the following is a drug of choice for a pregnant mother with chronic hypertension? Option A, methyl-dopa, B, atenolol, C, diazepam, D, magnesium sulfate. Right answer is option A, methyl-dopa. Methyl-dopa is a drug of choice for pregnant mother with chronic hypertension because this drug does not alter the maternal cardiac output or blood flow to the uterus or kidneys, while other drugs like atenolol has been associated with intrauterine growth retardation. Magnesium sulfate used to treat women with preeclampsia, and diazepam is not an antihypertensive drug. Next question. Bleeding from or into the genital tract after the 28th week of pregnancy but before the birth of baby is known as option A, APH, B, IPH, C, IUD, D, PPH. Right answer is option A, APH, that is antepartum hemorrhage. Antepartum hemorrhage is defined as excessive bleeding from or into the genital tract after the 28th week of pregnancy but before the birth of the baby. The main causes are placental bleeding, unexplained, and extraplacental. Next question. What is the most common site of ectopic pregnancy? Option A ovarian, B tubal, C abdominal, D cervical. Right answer is option B tubal. Ectopic pregnancy is a condition in which fertilized ovum is implanted outside the normal endometrial cavity. Most common site is the fallopian tube. In the tubal pregnancy, ampulla is the most common part, followed by isthmus, infundibulum and interstitial. Ovarian ectopic pregnancy is 0.5% and abdominal is 1%. Next question. Snowstorm pattern on ultrasound with no fetus or gestational sac is the characteristic of option A eclampsia, B placenta previa, C abruptio placenta, option D hydatidiform mole. Right answer is option D hydatidiform mole. Snowstorm pattern on ultrasound with no fetus or gestational sac is the characteristics of hydatidiform mole. In this condition, a rare mass or growth that forms inside the uterus at the beginning of a pregnancy. It is a type of gestational trophoblastic disease. The chorionic villi of a molar pregnancy resembles a snowstorm pattern on ultrasound. Bleeding with a hydatidiform mole is often dark brown and may occur erratically for weeks or months. Next question. What is the most common cause of BPH? Option A atonic, B traumatic, C retained tissue, D blood coagulopathy. Right answer is option A atonic. All the above mentioned are the causes of PPH, that is postpartum hemorrhage, but the most common cause is atonic uterus. In 80% of the cases, the PPH occurs because of the uterine atony. Next question. As per WHO, anemia in pregnancy is diagnosed if the hemoglobin level is option A less than 10 gram per dl, B less than 11 gram per dl, C less than 12 gram per dl, D less than 13 gram per dl. Right answer is option B less than 11 gram per dl. During pregnancy, hemodilation occurs. So as per WHO, anemia in pregnancy is diagnosed if the hemoglobin level is less than 11 gram per dl. Next question. Hazard associated with gestational liabilities is option A polyhydramnios, B macrosomia, C birth trauma, D all of the above. Right answer is option D all of the above. So the hazard associated with gestational liabilities is polyhydramnios, macrosomia and birth trauma. So this is the today's video. Thank you so much for watching my video.